But as we had predicted in the Ministry of Health, come the month of March, we may begin to see some surge upwards. Today, we report the highest number since last year at 713 people who have contracted the disease, the virus, over the last 24 hours only. This is out of a sample size of some 5,230, but even as we increase the sample size to a minimum of 7,000, having received the necessary reagents, the sheer number itself tells you the whole story. Today, also, the positivity rate that we are announcing at about 14% is also the highest one since the last phase is sometime in November. I therefore want to support and agree with the Council of Governors that now the time has come to start looking back at some of the measures that we have taken, whether to increase and to stop and make some mandatory requirements of our population. And therefore, as we debate this matter today and tomorrow, the President will be speaking to us on Friday, and on that date, by that date, we will have agreed, and with our scientists, immunologists, and the modeling team, to see where we are going forward and the measures that we must take. I think all Kenyans will be aware that the third wave has been in other parts of the world, including Europe, with devastating effects. And our hope and prayer is that this is not what we are going to experience in our nations. Already, I think you have seen an increase in numbers of the cases that are in our hospitals. We have seen an increase in numbers of those who are on ventilators. We have seen an increase in number on those who need oxygen. And therefore, we must continue with vigilance to ensure that these cases do not overrun our healthcare system. 167 patients have also recovered, so it's not all gloom and doom. 115 from home-based care, while another 52 from isolation. And our recovery rate so far is a good one at over 80%. And therefore, we stand well in terms of recoveries across the country and indeed over the last 1 year. But again, you will recall that yesterday, we lost some 7 patients. Today, we have lost another 12 patients. And you can see the numbers are going up. So our cumulative total now has been pushed to some 1,898. Currently, there are 563 patients who are currently admitted in various health facilities across the country, while some 1,588 patients are now on home-based care. You will also note, as I had mentioned, that the number of patients in ICU have gone up at 89 patients, nearly 90 patients are now in our intensive care units. And you will recall that this number had gone to even less than 20 sometime in January. And that does not even include another 28 patients who are now on supplementary oxygen. So, my good friends, in conclusion, let me say that we are about to start another difficult period. But I know that having overcome the first two, we can also overcome this one. I know that this time round, people feel tired. I am tired as well. People are strained. It's taken a toll on us over the last 1 year. But we also know that it is at this time, when we feel the way we feel, that we can let our guard down, adopt a don't care attitude, that then we will be hit hard. hardest. And therefore, let's all work together. Let's renew our commitment, even as this new one comes at us. Let's renew our commitment to ensuring that we can save each other and save our loved ones. Thank you very much.